Good day everyone, I am Minya, your student nurse, and we will tackle today about the autobiography of the drugs aminophylline and caffeine.
Hi, I am AMINOPHYLLINE and my brand names are Truphylline, Somophylline, and Philocontin. And this is my chemical name. My therapeutic drug classification is bronchodilators and anti-asthmatics. And my pharmacologic drug classification is xanthines. And I belong to the pregnancy category C. And my mechanism of action goes like this. I relax the smooth muscle of the bronchial airways and the pulmonary blood vessels and reduces the airway responsiveness to histamine, methacholine, adenosine, and allergen. I competitively inhibits type 3 and type 4 phosphodiesterase, the enzyme responsible for breaking down cyclic AMP in the smooth muscle cells, possibly be resulting for bronchodilation. I also binds in adenosine A to B receptors and blocks adenosine-mediated bronchoconstriction. I activate histone deacetylase to prevent transcription of inflammatory genes that requires acetylations of histones for transcription to begin. I am completely absorbed by the body and converted as theophylline, which is up to 40% bound by albumin. I am distributed freely throughout the body except for body fat. I occur in the liver via cytochrome, then converted as theophylline, then metabolized in inactive compounds, and excreted in the urine as theophylline for 10%. My indications are symptomatic relief of acute bronchospasm, maintenance infusion, chronic bronchial asthma to treat paroxysmal nocturnal dyspnea, and reduction of severe bronchospasm in infants with cystic fibrosis. And now let us talk about my contraindications. I am contraindicated with hypersensitivity to any xanthine or any ethylene diamine. I am also contraindicated with patient who has peptic ulcer, active gastritis, rectal or colonic irritation or infection, and you should use me cautiously with patient who has cardiac arrhythmias, acute myocardial injury, severe hypertension, severe hypoxemia, renal or hepatic disease, hyperthyroidism, alcoholism, labor, lactation, and pregnancy. And now, let us talk about my side and adverse effects in different systems of the body. In the central nervous system, my adverse and side effects are irritability, restlessness, dizziness, muscle twitching, seizures, severe depression, stammering speech, abnormal behavior characterized by withdrawal, and unresponsiveness alternating with hyperactive periods. My adverse and side effects in the cardiovascular systems are palpation, sinus tachycardia, ventricular tachycardia, life-threatening ventricular arrhythmias, and circulatory failure. My adverse and side effects in the digestive system are loss of appetite, hematemesis, epigastric pain, and gastroesophageal reflux during sleep. My adverse and side effects in the genitourinary systems are proteinuria, increased excretion of renal tubular cells and RBCs, diuresis, and urinary retention in men with prostate enlargement. My adverse and side effects in the respiratory systems are tachypnea and respiratory arrest. And my other side effects are fever, flushing, hyperglycemia, and rash.
So now let us move forward to the nursing responsibilities. Before administering the drug, you must assess the history of hypersensitivity to any xanthine or to ethylene diamine, peptic ulcer, active gastritis, cardiac arrhythmias, acute myocardial injury, congestive heart failure, cor pulmonale, severe hypertension, severe hypoxemia, renal or hepatic disease, hyperthyroidism, alcohol, labor, lactation, rectal or colonic irritation or infection. In the physical assessment, you must consider the bowel sounds, normal output, pulse, auscultation, blood pressure, perfusion, electrocardiogram, respiration, adventitious sounds, frequency of urination, voiding, normal output pattern, urinalysis, LFTs, renal function test, liver palpation, thyroid function test, skin color, texture, lesions, reflexes, bilateral grip strength, affect, and electroencephalogram. During. Administer to pregnant patients only when clearly needed. Neonatal tachycardia, jitteriness, and withdrawal apnea observed when mothers receive Santines up until delivery. Second, caution patient not to chew or crush enteric-coated time-released forms. Third, give immediate release liquid dosage forms with food if GI effects occur. Fourth is, do not give time-released forms with food. These should be given on an empty stomach 1 hour before or 2 hours after meal. Fifth is maintain adequate hydration. Sixth is monitor results of serum theophylline levels carefully and arrange for reduced dosage if serum levels exceed therapeutic range of 10 to 20 mcg per ml. Seventh, take serum samples to determine peak theophylline concentration drawn 15 to 30 minutes after an IV loading dose. Eighth is monitor for clinical signs of adverse effects, particularly if serum theophylline levels are not available. Ninth is ensure that diazepam is readily available to treat seizures. Moving on to the after. Take this drug exactly as prescribed. If a timed release product is prescribed, take this drug on an empty stomach 1 hour before or 2 hours after meal. Second is, do not chew or crush time-release preparations. Third, administer rectal solution or suppositories after emptying the rectum. Fourth, it may be necessary to take this drug around the clock for adequate control of asthma attacks. Fifth, avoid excessive intake of coffee, tea, cocoa, cola beverages, and chocolate. Sixth is, smoking cigarettes or other tobacco products impacts the drug's effectiveness. Try not to smoke. Notify your healthcare provider if smoking habits change while taking this drug. Seventh is, frequent blood tests may be necessary to monitor the effect of this drug and to ensure safe and effective dosage. Keep all appointments for blood tests and other monitoring. 8 is that you may experience these side effects: nausea, loss of appetite. Taking this drug with food may help if taking the immediate release or liquid dosage forms. Difficulty sleeping, depression, and emotional lability. 9th is report nausea, vomiting, severe GI pain, restlessness, seizures, and irregular heartbeat.
Hi, I am Caffeine. My generic name is also Caffeine. I may also be known in some brand names, such as Caffedrin, Taxitac, Dorvitan, Energetics, No Dose, Pep Back, Quick Pep, and Wake Up. My chemical name is... As for my drug classification, for therapeutic, I am classified as stimulant. As for the pharmacologic, I am classified as Santin. For my pregnancy category, I am classified as pregnancy category C, which indicates that animal reproduction studies have shown an adverse effect on the fetus and there are no adequate and well-controlled studies in humans, but potential benefits may warrant use of the drug in pregnant women despite potential risks. My mechanism of action is complex as I affect several body systems. First is general and cellular actions. I exert several actions in cells. One probable mechanism is the inhibition of nucleotide phosphodiesterase enzymes, adenosine receptors, regulation of calcium handling in cells, and participates in adenosine receptor antagonism. Phosphodiesterase enzymes regulate cell function via actions on second messengers, CAMP and cGMP. This causes lipolysis through activation of hormone-sensitive lipase releasing fatty acids and glycerol. As for respiratory, my exact mechanism of action in treating apnea related to prematurity is unknown. However, there are several proposed mechanisms, including respiratory center stimulation in the central nervous system, a reduced threshold to hypercapnia with increased response and increased consumption of oxygen, among others. The blocking of the adenosine receptors enhances respiratory drive via an increase in brain medullary response to carbon dioxide, stimulating ventilation and respiratory drive while increasing contractility of the diaphragm. As for the central nervous system, I demonstrate antagonism on all four adenosine receptor subtypes, A1, A2A, A2B, and A3 in the central nervous system. My effects on alertness and combating drowsiness are specifically related to antagonism of the A2A receptor. As for the renal system, I have diuretic effects due to my stimulatory effects on renal blood flow, increase in glomerular filtration, and increase in sodium excretion. As for the cardiovascular system, adenosine receptor antagonism at the A1 receptor by me stimulates inotropic effects in the heart. Blocking of adenosine receptors promotes catecholamine release, leading to stimulatory effects occurring in the heart and the rest of the body. In the blood vessels, I exert direct antagonism into the adenosine receptors, causing vasodilation. This stimulates the endothelial cells in the blood vessel wall to release nitric oxide, potentiating blood vessel relaxation. Catecholamine release, however, antagonizes this and exerts inotropic and conotropic effects on the heart, ultimately leading to vasoconstriction. Finally, I have shown to raise systolic blood pressure measurements by 5 to 10 mm of mercury when it is not taken regularly, versus no effect in those who consume it regularly. The vasoconstricting effects of me are beneficial in migraines and other types of headaches, which are normally caused by the vasodilation in the brain. And now for my pharmacokinetics. As for absorption, I am rapidly absorbed after oral or parenteral administration, reaching peak plasma concentration within 30 minutes or 2 hours after administration. After oral administration, onset of action takes place within 45 to 1 hour. Food may delay my absorption. My peak plasma level ranges from 6 to 10 milligrams. My absolute bioavailability is unavailable in neonate 16 but reaches about 100% in adults. As for distribution, I am widely distributed throughout the body. I have the ability to rapidly cross the blood-brain barrier. I am water and fat soluble and distributes throughout the body. The mean volume of distribution of caffeine in infants is 0.8 to 0.9 liters per kilogram and 0.6 liters per kilogram in the adult population. My plasma protein binding has not been determined for neonates or infants. In vitro studies indicate a protein binding of 10 to 36%. I am reversibly bound to plasma proteins. As for metabolism, I am metabolized almost completely hepatically by oxidation, methylation, and acetylation. As for excretion, I am excreted in the urine as the major metabolites of caffeine can be found excreted in the urine. About 0.5% to 2% of a caffeine dose is found excreted in the urine. It is because it is heavily absorbed in the renal tubules. As for indication, I am indicated for the short-term treatment of apnea of prematurity in infants and off-label for the prevention and treatment of bronchopulmonary dysplasia caused by premature birth. In addition, I am indicated in combination with sodium benzoate to treat respiratory depression resulting from an overdose of CNS depressant drugs. I have a broad range of over-the-counter uses. I am found in energy supplements, athletic enhancement, pain relief products, and as well as cosmetic products. As for my contraindications, although there are no absolute contraindications to me, there are some medical conditions in which caution is necessary, which includes severe anxiety, cardiovascular diseases, peptic ulcer disease, hepatic impairment, renal impairment, seizures, and pregnancy. As for side and adverse effects, for CNS, it includes insomnia, restlessness, nervousness, and mild delirium. As for the GI, it includes nausea, vomiting, and gastric irritation.
It's me again. For the caffeine nursing responsibilities, before administering the drug, you must assess patient's records and determine if there is any hypersensitivity to xanthine and take note of the mentioned contraindications. During administration, administer to pregnant patients only when clearly needed. Give immediate release liquid dosage forms with food if GI effects occur. Third is, monitor vital signs closely as large doses may cause intensification rather than reversal of severe drug-induced depression. Fourth is, observe children closely following administration as they are more susceptible than adults to the CNS effects of caffeine. Fifth is, monitor for clinical signs of adverse effect. Sixth is that, ensure that diazepam is readily available to treat seizure. Now we are in the after. Take this drug exactly as prescribed. Second is that smoking cigarettes or other tobacco products impacts the drug's effectiveness. Try not to smoke. Notify your healthcare provider if smoking habits change while taking this drug. Third is that frequent blood tests may be necessary to monitor the effect of this drug and to ensure safe and effective dosage. Keep all appointments for blood tests and other monitoring. Fourth is that the nurse should take note of the client as he or she may experience these side effects. Nausea, loss of appetite, taking this drug with food may help if taking the immediate release or liquid dosage forms. Difficulty sleeping, depression, and emotional lability. Lastly, let the patient report nausea, vomiting, severe GI pain, restlessness, seizures, and irregular heartbeat. So this ends our discussion. We hope you learned something from us. Thank you for watching.